Hi, it's me of Healthy by George. So, we want to answer those questions that we're all concerned about when it comes to a hip replacement. And what's so wonderful or not, depending on how you look at it, I've had two hip replacements, and I'm joined by my brother, a nurse practitioner of over 30 years, who also had a hip replacement recently. And our mother had a hip replacement in the fall of 2025. So, we want to talk about the top five concerns of hip replacements. And so, we can help you manage if you have a hip replacement coming up, that you can start to feel less afraid. Please think about subscribing. We would love to see you here each week. It is easy. Click that like button and share. And please join us because I would love to include you. So, again, welcome, my brother. I'm always happy to see you.
Thank you so much for having me. I love being with you.
Yes, it's always wonderful to put our conversations about hip replacements on a dialogue that helps other people understand once you've gone through
Just
it.
like when we can compare notes and
Yeah.
things that might benefit someone else.
I've had two hip replacements that both had complications, but you've had an easy hip replacement where it was really straightforward, right?
It was so much smoother than I ever anticipated. And I was so nervous prior to having the surgery
Well, I
because I
that's
had this
we all
fear.
feel. We're afraid because it's such a big decision.
Yes. And all the things that possibly could go wrong.
Correct. And I think the first thing that we always fear is that somehow there's a complication due to infection or a blood clot or something unknown. Have any of those?
Also, none. I wanted to make sure I had the hip replacement so that I wouldn't wear the joint out because
No.
used to the joints would only last about 10 years, but
Well,
now they
now they
last for a long time,
last what? 20,
20
25
plus.
years? What kind of level of pain did you have prior to your hip surgery?
Real horrible. I could barely get out of the car. Up and out of a chair was a nightmare. If I had to walk more than 2 blocks, I was in agony all the time.
Really? For me, I could do a block with walking the dog with a cane. And it was excruciating. But I think what drove me from not wanting to have a hip replacement for almost a year and a half was the sheer fear of having a complication. When you've had a prior hip replacement, which is what I did, and I had a freak episode where I broke my femur in physical therapy, which was a freak accident, it makes you very afraid.
Did you know that you would eventually have the other one done too?
No, not really. Because again, I think surgeons are not used to educating patients. They turn it over to a class, which is what we are all required to do, an educational class. And so there's this gray area of what to expect that somehow the nurse or who's ever educating you sort of turns it over to them to ask. If you ask complicated questions, they sort of like boot it back to the surgeon. And so I think it is hard. No surgeon wants to expect complications, right?
You try to minimize
Mm.
infection, problems with anesthesia, stuff
Right.
like that.
But typically they use a nerve block.
Initially, I thought I was gonna go under general anesthesia because I thought it took longer than an hour and a half to do the procedure, but apparently it only takes an hour and a half. It took an hour and a half for my whole surgery. Entire
Wow.
surgery from beginning to end was an hour and a half.
And they just,
They did an epidural to begin with, and then at the site, they did an nerve.
yeah, I had a epidural as well. And unfortunately, I was in the small percentage of people who have side effects to an epidural. It wasn't terrible. It's just that no one warned me, and I've never had an epidural. So it was
So rare
unexpected.
too. There's so few people that actually have side effects to epidurals,
I know.
but you would have you
It's
would have
very it's less than 5%, right?
yeah, it's a
So
very small
it's
percentage.
very, and yet I had where in the first 24 hours after my procedure, my blood pressure dropped very low. And so they had to keep turning me upside down. But that's very rare. And it doesn't kill you. It just makes you feel uncomfortable. But what
Well,
about
I actually was mine was so quick. When I woke up, I said, "It's over?"
that's a
I couldn't believe it.
And then they have you stand up right after it, right?
I got up. I thought, oh my God, the pain's gone. And it's not the pain you had before. It's now a surgical pain, which is nothing like the old
Nothing
pain.
like the hip
Like,
pain, right?
it's a welcome pain almost
It's
because you know it's
shocking.
superficial. It was wonderful. And I feel so much better.
I know. So, that's why you really feel excited that your pain that you've been feeling that's so excruciating, it's now this sort of exterior pain, right? And so, what was your recovery like? Because you had an anterior, which newer procedure for hip replacements.
I had anticipated weeks of recovery, but by the third or fourth day, I was without the walker. I was driving, doing most of my activities. I couldn't squat or bend down too low, but I was doing almost all of the normal activities.
And see, I think that's really probably due to your physiology and probably due to that you have a long history of doing more muscular. Do you think?
Yeah, that helps. I asked my doctor, where are you going to send me to physical therapy? He said, I don't expect you to need physical therapy. You just need to walk. I said, that's it? He said, yes, walk, walk, walk. He said, you're going to be walking with a walker. And as soon as you feel stable enough, you're going to go. They do this assessment on you after surgery with a physical therapist to determine if you need more extensive physical therapy
Right. And
or
see, and
occupational.
mine, my hip replacement was a posterior, which is more of the common process where it's more going through the muscle and the back tissue.
Both were posterior.
Both were posterior. And maybe that's because of my physiology. I'm not sure, but I was much thinner for this surgery than I was for the first surgery. I was 55 pounds thinner. Anticipated having no problems. I had the mysterious hematoma. I
I
think,
remember you going,
you
oh
just
my God.
never can predict. Well, I was grateful there's no infection. So there was no infection. There was just the strange hematoma. And what is a hematoma?
It is a accumulation of like a blood clot. The word hema means blood. Toma means a round ball. It's like a ball of blood clot.
Right.
Blood clot is like it's accumulation of blood
And see, that's
in an
the
area. But
problem.
it,
All of this blood accumulated right under my incision, not once, but twice. And we don't really know why still. I think it has something to do with the low hemoglobin that I have.
nicked something, but he didn't.
No, there was no bleeding inside the incision. They must have scanned me twice with a CT to look for a bleed. Nothing. No one could explain why I was having this.
Remember, you got how many units of blood?
So I got 2 pints of blood because my hemoglobin dropped to below 6, and
Then it
that's
came up
very
to what?
serious.
2 units.
Huh?
How much
It
did it
gave
come up
me
to after 2 units?
2 units
Didn't I thought,
to
oh, that's
7.
not very much.
It came up to 7, that was it.
Two
No, I think
units
that it didn't come up to 7.
went down again.
It went down and had to give me
Yep.
the
The
erythropoietin, the drug
procreate,
that
erythropoietin.
stimulates.
When you told me the results, I said, that's not possible.
It was so strange. Everybody was scratching their head, but I feel like I'm that the key is that I never felt afraid. I never felt uncertain. I felt glad that it was not painful. My incision never hurt. The area where it felt muscular pain more than anything.
Remember you telling me it was really swollen
Yeah,
initially.
it was very swollen, but that was due to, I think, the accumulation of blood. So, I think the key is that you just do your best, and most people recover well. Most people have a pretty good recovery. I think that I fall into that small percentage of people who have challenges. How do you help
Right.
someone when they're thinking about physical therapy and they feel afraid to move because they've had this challenging hip replacement and
There we
oh,
go.
it's amazing.
All right.
Here's my yeah. So, how do we get over that fear of moving, especially when we've put off the idea of doing anything about our hip for a while and we've become very sedentary and fearful about moving? To
Because
get
that
over that.
pain is truly awful. It's so bad. You don't want to get up out of the chair. You don't want to get up out of the bed. And so in your mind, you think, okay, I'm going to get hip replacement. You can't imagine being out of that pain anymore. All you know is that if you move, you might mess the hip replacement up. And that's what your fear is. You actually think that there's nothing that's going to be as strong as the prior hip.
I know, and it's really surprising that dislocations don't happen very frequently. They did a meta analysis of nearly 5 million hip replacements, and less than 5% have dislocations in the first 3 to 6 months. So that's really very positive when it comes to dislocation. But what's the fear of uneven, feeling like your legs are uneven after surgery?
That can happen sometimes prior to surgery because of the way the bone, especially if you have avascular necrosis, can collapse in on itself,
Mm.
or if they have bone loss or a degenerative joint disease where the bone actually is smashed down. Like my mom, hers
Right.
was splintered
Her
and her
hip
leg was an inch and a
fracture.
half short. Her
Really?
leg was horribly,
Well, after
unbelievable.
surgery, was it normalized?
Yeah, he actually normalized it and turned her foot in a little bit because she has a horrible spinal cord. So he did something so that it would help her with their scoliosis
Oh,
too.
wonderful.
But she
That
hasn't recovered the left quad muscle as much as she should, but it's coming
well,
slowly.
she's still in recovery. She had it late September, early October. So basically, they say it almost takes 6 to 9 months before you're really.
She was completely immobile and in horrific pain. She could barely get up.
Yeah.
How long she had waited.
Yeah. And see, she's 20 plus years older than we are. That's the key too. She did have some kind of pre existing condition with her asthma.
But we didn't know that until she got on the operating table. And that was one
Well,
of the delays. She was delayed by a month.
she didn't know the AFib existed.
Right.
So heart conditions, asthma, diabetes, all of these things can contribute to the challenges of recovery and anesthesia too. So, I think when you're facing hip replacement, it's almost like how do you deal with the unknown? Because that's truly what it's going to be like going into any surgery, especially if you've never had surgery.
This was the scariest one for me because I kept thinking of the disarticulation of the hip joint. And I kept trying to imagine how do they go in and how do they remove the bad bone and how do they get this piece up in there in such a small incision?
I know.
And they do it with a robot mostly. And then the end of the surgery is kind of manual,
You
but they
know,
do all of the measurements with the robotic device. They make sure everything is exact. And then they put this big porcelain thing up. They put a plastic kind of, I don't know if it's, they put something in the hip pelvis area and then the ceramic thing and then another plastic rubber thing. And then titanium is attached to that.
yeah, it's kind of
Oh, if it's on that.
that's amazing. What made you feel less afraid knowing that you were going into the unknown of this surgery?
And looked at the success rate of the surgeon, how many infections he's had, how successful he's been. I looked at all of the remarks that patients had made about
Yeah.
him and about the center he was
Makes a
in,
difference, doesn't it?
and that made a big difference. He's very good. He calls every patient the day afterwards
Yep.
and speaks to you verbally, and he still calls me and says, "You're doing okay."
Yep.
So
I think that is the key is feeling confident about your surgical team. Even though I had had complications with my first hip replacement, I felt so confident about my surgeon because he was so available to me and answered my questions. He was very sympathetic about the circumstances. It wasn't like there was any blame. It was just sort of, wow, this happened and we can't
we
explain
say
it.
their names, or we can't say their names.
Well, mine was Dr. Muha. Who was yours?
I'm Dr. Prem Kumar at Emory. He was
Yeah.
phenomenal. His team was incredible.
Oh, I have
They
to
were
tell
so
you, Muha's team was amazing. They were phenomenal. And they kept scratching their head about why am I having all of this blood?
we should have said, "Oh, you're in trouble.
Well,
You're in
guys,
trouble."
look, the swelling started right after surgery, and then the side effects to the spinal tap started happening. He's like, I can't believe this.
Was shocked at how well I did. I did so well that it convinced mom to do her
I
surgery.
know she was
That's
very afraid. I know she was convinced that it's doable. And so she was more willing
and
to.
they actually agreed to do it. Not many places would operate on an 86-year-old female.
No, she had to go through a lot of pre clearance prior to that.
Yes.
but she did phenomenal. So,
She did
so
incredible.
what's one
She's
message,
still
huh? What's one message we could share people who have a hip replacement that they have to consider in their future?
do it sooner.
Do it.
Do it at a center of excellence
Yeah,
if you can.
if you can.
Look at the surgeon's results and the rate of infection. And they want you to watch his surgery. I just never could watch the
Oh,
surgery.
no. I could
I
never
couldn't,
watch this.
even though I've seen surgery, watch it.
No, I can't watch the surgery. Can't.
And
No,
I wanted to see the bone afterwards, but he wouldn't show it to
no,
me.
that either.
If you don't feel comfortable with your surgeon from day one, go to another surgeon
I
because it's
totally
so
agree.
important to be
Yes.
very comfortable and feel safe with your surgeon.
Yeah, you really need to feel a confidence with your surgical team that makes you feel comforted and that this person is being caring about how you're going to do for surgery. It makes a big difference. I can't thank you enough for coming on and sharing about you.
Thank you for having me.
And I
And
know
for all the replacement people that need a hip replacement, do it sooner.
go ahead and do it because it's really not as bad as you think. The pain is worse than getting the surgery, frankly,
I
about
agree.
subscribing. I would love to see you here. Remember, we have this one precious life. Let's live it intentionally and take an action if you're in pain with your hip. Take care, my
Definitely.
brother. Be well.
See you. Bye-bye.
So, thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.